Good evening, everybody. Just waiting a moment here for everybody to connect to audio. We will get started. Okay, let's go ahead and get started. Good evening, everybody. Thank you for joining. My name is Mariana Moles. I'm a communications officer with the Public Health Department here in Santa Clara County. Today we have updates about monkeypox. I would, at this time, like to invite each outlet to type the name of their outlet in the chat so that we have a list of who's present here tonight. During the question portion of the presser, I will be calling on each outlet to ask one question. If you have follow-up questions, great. We are happy to answer those, but we do want to give everybody a chance to ask one question. And just as a reminder, this is being recorded and live streamed on our social media channels. And with that, I will hand it over to Deputy Health Officer, Dr. George Hahn.
Thanks, Mariana. And I think I see a couple of outlets still connecting to audio. Should we confirm that? I think I see KTVU and KGO still connecting. KTVU, can you hear us? Or KGO?
It's also being live streamed, so.
I wonder if we should just let them know. I can just type in KTVU and KGO. Can you hear? Yeah.
You might want to just go ahead and get started, George. We are live streaming and recording this, so we can follow up with them if we need to.
Sounds good. Good evening, everyone. I'm Dr. George Hahn, Deputy Health Officer for the County of Santa Clara Public Health Department. Pleased to join you tonight to give you an update on our monkeypox response. As of today, there are 31 cases of monkeypox reported in residents of Santa Clara County. And the Public Health Department has successfully vaccinated more than 225 individuals, including more than 150 at our first large monkeypox vaccine clinic yesterday. In addition, many vaccines received by the county have been allocated to large healthcare systems, and many are also being administered directly by the county. The county is distributing monkeypox vaccines equitably by prioritizing individuals at highest risk first and vaccinating individuals who have been in direct physical contact with someone with monkeypox. Public Health is partnering with LGBTQ community organizations who are an important part of the local response to monkeypox, given the populations who are being impacted the most right now, and we're grateful for their leadership and honored by their collaboration with us. And this involves planning events and sharing resources related to prevention, testing, and vaccination. And as a matter of fact, just now we had a virtual town hall, and we will have another town hall in about an hour. So at this time, I will open up the floor to questions.
Okay, great. So let's get started with Kron.
Hi there. Obviously, we are seeing a limited supply of vaccines across the Bay Area. San Francisco really having a hard time keeping up with the demand. What is the county doing to make sure that they are getting more supplies and reaching the need of people that need this vaccine and are asking for it?
Well, as we all know at this time, the supply of monkeypox vaccine comes from the federal government supply, and they allocate directly to the states, and we get our allocation from the state public health department. What we are doing is advocating directly with the state public health department for more vaccine doses. And they will make a decision on whether or not they're able to allocate that to us based on their own supply. And so we encourage advocacy from community members to really call upon the federal government for more vaccine supply. It is true that the demand for monkeypox vaccine for those who need it is greater than the supply that we have. And here in Santa Clara County, we are eager to receive more vaccine, and that we're ready to give it to the community and community members when we do have the supply.
Great, thank you. And now Gabriel with Mercury News.
Yeah, hi, thank you, Dr. Hahn. My question for you is, so this virus has been mostly affecting the LGBTQ community. Are you seeing cases at the moment outside of that community? And if not, do you expect cases to start spreading outside of that community? What does that look like right now?
With the current monkeypox outbreak here in the United States and here in the Bay Area, spread has been primarily between men who have sex with men, and that has certainly been true here in Santa Clara County. So at this time, that is the reason why we are focused so much on partnering with our LGBTQ community partners to reach this community. I do expect that there will be some cases at some point that in folks who are not in the LGBTQ community. We just don't know when that will happen or how frequently that will happen. And right now we're focused on the community who is most at risk because, first of all, those are the folks who need the information, the vaccinations, the treatments, the help, and if we can prioritize this population first, that can help stop the spread and potentially limit the spread among other community members.
Okay, thank you. And then we have Maria with Univision.
Yes. I think I sent my comment or my question in the chat. If you can just confirm the number of cases in the county, I think you just mentioned it, but also who is eligible to receive the vaccine? Like anyone who might be suspecting that was in contact, or if you can just specify who is eligible to receive the vaccine.
Sure. So we have 31 cases in Santa Clara County as of this morning. And in terms of who can receive the vaccination, they are broadly fall into two categories. One is anyone who's been in contact with someone who has monkeypox, direct physical contact, especially sexual partners of people who have monkeypox. And then the second group, which is the group that we just opened up eligibility for this week, is people who have no known contact with a person with monkeypox, but who are at high risk of possibly getting monkeypox in the future. And so that's who we're really focused on right now. Those include gay and bisexual men and trans individuals, and who have certain risk factors, and those are listed in the eligibility criteria that we've posted to our website.
Thank you. KGO, do you have a question? Okay, KTVU, I see you're having audio issues. If you would like to put your question in the chat, that would be great. KPIX. Okay, at this time, I'd like to invite any of the other outlets if you have follow-up questions.
I just have one more question. This is Taylor with Crown 4 again. I know we had talked about who is eligible for the vaccine. Are you only opening up testing to a certain group of people, or is it only once they start showing those physical lesions? Who's able to get tested right now?
Anyone should be able to get tested right now, and the reason for that is because over the last couple of weeks, testing has expanded to major commercial laboratories in the United States. And what that means is most people should be able to go to their doctor and ask for monkeypox testing, and their doctor should be able to test them. So that's really great news that anyone who has symptoms that may be suspicious for monkeypox can be tested, and that is not limited to any particular group of people. In terms of, and could you repeat the second part of your question?
You answered it. I was just asking because I know at one point San Francisco was only allowing people with the physical lesions to get tested. So I just wanted clarification if it was the same for your county.
Yeah, well, this is a little bit of a medical question, which is the best specimen that you can use to test for monkeypox is when you can get a little piece of the lesion, the skin lesion, and put it into a tube. And so, having that lesion, that skin lesion, is really important to be able to test for monkeypox. So that's kind of the medical side of the question. There is one other thing I wanted to add, which is in terms of vaccine, people who already have monkeypox should not receive the vaccine, but they may be eligible for treatment. There is a treatment for monkeypox, and that's separate from the vaccine. And then people who have symptoms that may be monkeypox also should not receive the vaccine. Instead, they should, seek their medical healthcare provider as soon as they can for testing and evaluation. They may have monkeypox, but the only way to find out is if they're tested, and so that's why they should not receive the vaccine because they might have monkeypox. If they end up being tested and have something else, then they would be able to potentially receive a vaccine if they are in one of the high-risk groups.
Sorry, I just have a follow-up to that. I know that that people have mentioned before that if they get the vaccine while having monkeypox or right before the beginning stages, that it could actually lessen the symptoms. So you are recommending that if you have the symptoms or if you have monkeypox to not get the vaccine at all.
That is correct. What you're referring to is if you've been exposed. So if you've been exposed to monkeypox, you should get the vaccine, and within a certain period of time. So ideally within 4 days of being exposed to monkeypox, but perhaps up to 2 weeks. And so if you are able to get vaccinated after you've been exposed, within that narrow time frame, you may be able to prevent getting monkeypox. Now, that's not perfect, and so many people still do get monkeypox even if they get their vaccine in time after that exposure. But even if you do get monkeypox, the symptoms would be lessened. And so we do provide vaccine for that purpose for people who know they've been exposed and who are not yet symptomatic.
This is Gabriel Grashler, Mercury News. Do you have any word from the federal government when the next batch of vaccines will be coming to Santa Clara County?
Unfortunately, nothing confirmed yet. We're hearing that maybe in a couple of weeks we may be receiving some more allocation, but no confirmation.
Are there any other follow-up questions at this time?
If I may, how many doses does Santa Clara County have on hand right now?
That's a good question. That changes by the hour. So, Mariana, perhaps we could get back?
Yes, of course.
Yeah.
Thank you, I appreciate it.
Okay, well, thank you so much for joining us. Have a good evening.
Thank you.